Chickenpox, also known as varicella, is a highly contagious disease caused by the varicella zoster virus, VZV. It is characterized by an itchy rash with red spots and fluid-filled blisters that eventually scab over. While it is generally mild in healthy children, it can be more severe in adults, pregnant women, and immunocompromised individuals. Before the introduction of the chickenpox vaccine, the disease was very common, particularly among children. Causes and transmission. Chickenpox is caused by the varicella zoster virus, VZV, a member of the herpes virus family. It spreads easily from person to person through direct contact, touching the blisters or fluid from the sores. Airborne transmission, inhaling respiratory droplets from an infected person's coughs or sneezes. Indirect contact, touching surfaces contaminated with the virus, though this is less common. The virus can start spreading 1 to 2 days before the rash appears and remains contagious until all blisters have scabbed over. Symptoms of chickenpox. The symptoms of chickenpox appear 10 to 21 days after exposure to the virus and typically last about 5 to 10 days. Early symptoms, prodromal stage. Fever, usually mild but can be high in severe cases. Headache. Fatigue and weakness. Loss of appetite. Main symptoms, rash stage. Red spots, macules, appear on the face, chest, and back before spreading. Blisters, vesicles, form, filled with fluid and very itchy. Crusting occurs as blisters break and scab over. A person with chickenpox may have all three types of lesions, red spots, blisters, and scabs, at the same time. Complications of chickenpox. While chickenpox is usually mild, complications can occur, especially in adults, pregnant women, newborns, and immunocompromised individuals. These complications include bacterial skin infections. Scratching the blisters can introduce bacteria, leading to infections such as impetigo. Pneumonia. Adults, smokers, and pregnant women are more at risk of developing varicella pneumonia. Encephalitis. Brain inflammation, though rare, this can be a life-threatening condition. Reye's syndrome, a rare but serious condition that affects the liver and brain, often linked to aspirin use in children with viral infections. Congenital varicella syndrome. If a pregnant woman gets chickenpox, it can cause birth defects or complications in the baby. Shingles, herpes zoster. The varicella zoster virus remains dormant in nerve tissues and can reactivate later in life as shingles, a painful rash. Diagnosis. Doctors usually diagnose chickenpox based on clinical appearance, the characteristic itchy rash with different stages of lesions. Medical history, whether the person has had contact with an infected individual. Laboratory tests, if necessary, blood tests or polymerase chain reaction, PCR, tests can confirm varicella infection. Treatment and management. There is no specific cure for chickenpox, but treatment focuses on relieving symptoms and preventing complications. 1. Home remedies. Rest and hydration. Drink plenty of fluids. Cool baths, oatmeal or baking soda baths can relieve itching. Calamine lotion, help soothe the skin. Loose clothing, wearing soft, loose-fitting clothes reduces irritation. 2. Medications. Antihistamines, example diphenhydramine, help relieve itching. Acetaminophen, paracetamol, helps reduce fever and pain, avoid aspirin in children. Antiviral drugs, example acyclovir, recommended for high-risk individuals if given within 24 hours of the rash appearing. Prevention. The best way to prevent chickenpox is through vaccination. 1. Varicella vaccine. First dose, given at 12 to 15 months of age. Second dose, given at 4 to 6 years of age. For older individuals, 2 doses are recommended at least 4 weeks apart. The vaccine is about 90% effective at preventing chickenpox. 2. Avoiding contact. Infected individuals should stay home until all blisters have scabbed over. Pregnant women and immunocompromised individuals should avoid exposure. 3. Post-exposure prophylaxis. In high-risk individuals, varicella zoster immune globulin, VZIG, may be given after exposure to prevent severe disease. Conclusion. Chickenpox is a common yet preventable viral infection that primarily affects children but can be serious in certain individuals. While most cases are mild and self-limiting, complications can arise, making vaccination the most effective way to protect against the disease. Understanding its symptoms, transmission, and treatment options can help manage the infection and prevent its spread.